According to the U.S. Surgeon General, even before the pandemic, about half of U.S. adults reported experiencing measurable levels of loneliness.
And in response, the Surgeon General is issuing a new advisory on loneliness today, the second day of Mental Health Awareness Month. And here with us to discuss is U.S. Surgeon General himself, Dr. Vivek Murthy. Welcome to you, and good to see you in person finally.
Thank you. It's good to be with you.
Now, of course. So on Sunday, you penned an op-ed in the New York Times titled, "We have become a lonely nation. It's time to fix that." How did this problem get so dire, and how is it impacting the entire country?
Well, first, I'm glad that we're talking about this because this is an issue so many people struggle with in the shadows, and they don't talk about their loneliness because they feel ashamed. And that was true for me as well. For many times in my life, when I was a child and then at other times when I was an adult, I struggled with loneliness but didn't really talk to people about it. And this is a problem that has been building for decades in our country. COVID certainly worsened it. It poured fuel on the fire, but that fire was burning before. And as the world has moved faster and faster, as things have changed so much, as we now move around a lot, we change jobs a lot, how we communicate with one another has changed and often shifted from in-person to online. A lot of that together has actually taken a toll on our relationships. And now we're realizing that we've got to be intentional about rebuilding those relationships because they have a profound effect both on our mental health and our physical health.
And Vivek, thank you for bringing this. This is the entire advisory here. You just told me it was about a year in the making. You've put a lot of work into this. You talk about the associated risks of loneliness that are really no different than smoking or inactivity. I mean, they're that significant. But in here, you also talk about 6 pillars of intervention. Which I think is so important. You define the problem, but you also offer solutions. Can you go through those 6 steps?
Yeah, I can go through the pillars, and I'm glad you also mentioned the health effects there, because this really is surprising to people to know, first of all, that nearly half of adults in America are saying that they are struggling with loneliness, but the numbers are actually greater among kids, which surprises people because they often think, well, children are more connected on technology, why would they be lonely? But technology is not always a substitute for in-person connection. But the health effects are profound. We're talking about increases in risks of depression, anxiety, and suicide, but also increased risk of heart disease and dementia, stroke, and the increase in the risk of premature death that we see with loneliness and isolation, with social disconnection, is on par with what we see with smoking daily, even greater than that which we see with obesity. So one of the reasons I issued this advisory is because I want the public to know that we have to treat loneliness as a public health priority as important as smoking, obesity, or the others.
It's crazy because you don't think of the consequences of loneliness being so dire. This is something that affects everyone, introverts, extroverts. How do you recognize loneliness, and how is it different than depression? Because I feel like that could be confusing.
Yeah, I'm glad you asked, because there is an interplay between loneliness, depression, and anxiety. We know that loneliness increases the risk for depression and anxiety, but we also know that when you're depressed, for example, people tend to withdraw more, and that can actually put you at risk for loneliness. So sometimes it is hard to tell, but what is true is that building strong relationships and connections actually helps us across the board, including when we're struggling with depression. And sometimes we need people in our life to tell us what's going on. That's what I needed. When I was struggling a few years ago with a real bout of loneliness, it was my wife, Alice, who stepped in and said, "Hey, I'm worried about you because you're not reaching out to people, you're not socializing with your friends. We need to change that. We need to help you rebuild your community."
And finally, you mentioned kids, and you've called declining mental health in American children the defining public health crisis of our time. How can we help our young people?
Well, I could not think of something that's more important than taking care of our kids' mental health. I say this as a father myself of a 5- and 6-year-old. I know many of us are parents, many people watching are parents, and a lot of us are concerned about our kids. We're hearing about what's happening to their classmates. I think there are a few critical things we've got to do to take care of our kids, recognizing again that suicide rates, depression rates, anxiety rates have skyrocketed among children. One is we've got to focus on making sure kids have treatment when they need it. It's one of the reasons we set up the 988 crisis line that anyone can call or text if they're having an emergency. But we've also got to eradicate the stigma around mental health that makes people think that it's their fault if they are struggling. And that's how we do that, by talking about this openly, by, as parents, talking to our children and letting them know it's okay to talk about your mental health. But third, and most importantly, most difficult, we've got to focus on the prevention piece, getting at the root of the problem. And one of the things that we've got to do here is not only build stronger social connections, which are protective and help improve mental health for our kids, but we've also got to recognize that technology has a role here too. Because currently we don't have sufficient guardrails around social media to make it safe for our kids, especially our youngest kids. That's an area where policymakers have a role.
Parent, second-term Surgeon General, Dr. Vivek Murthy, we know you're so busy. We appreciate you coming here for this important conversation, and thank you for this advisory.
Thank you so much.
What an honor.
All of you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.